Okay. Well, welcome everybody to NHS Barnsley Clinical Commissioning Group, known as Barnsley CCG. Today, I'm here to chair the Primary Care Commissioning Committee. My name is Chris Millington. I sit on the CCG governing body as a lay member. For ease this afternoon, the committee members will shortly introduce themselves one by one, and I'll call them out. This committee has an open invitation to NHS England, Barnsley's Director of Public Health, and Health Watch Barnsley. Our clerical support today is Leanne. So Leanne, if for any reason you didn't get words or phrases, you have my permission to say stop, which will enable you to put our meeting together. I'm sure it won't be necessary, but you'll have the power to stop us.
Okay.
Just to be clear, this meeting is being recorded for the benefit of the public of Barnsley, and it will be posted onto our Barnsley CCG webpage very shortly. A very warm welcome to Victoria Linden, who is the Assistant Head of Primary Care, Co-Commissioning NHS England. James Barker, who heads up our I Heart Barnsley operation, part of the Federation. I asked him to come along about a month ago to tell us and explain exactly what the Federation and the team in the Federation have been doing, and he will be doing that. Also a warm welcome to Carrie Abbott from Barnsley Council. So let's start the meeting with the introductions of the committee. So Nigel.
I am Nigel Bell. I'm lay member for governance on the governing body of the CCG.
Mike Sims.
I'm the Secondary Care Specialist on the governing body of the CCG.
Julie Frampton.
Hi, I'm the Head of Primary Care for Barnsley CCG.
Richard Walker.
Hello there, yeah, I'm the Head of Governance and Assurance at the CCG and a member of this committee.
Dr. Gunter Butler, welcome back to our wonderful organisation. Tell us about yourself very briefly.
Yeah, hi, Madhvi Guntumukla, I'm a GP at the Grove Medical Practice and Apollo Court Medical Centre and governing body member for Barnsley CCG.
James Barker.
Hi, I'm James Barker. I'm the Chief Exec at Barnsley Healthcare Federation.
Thank you. And NHS England. Victoria. Oh yeah, I can see you now, Victoria. Yes.
I was hiding for a moment. Hello, I'm Victoria Linden. I'm Assistant Head of Primary Care for NHS England and NHS Improvement in South Yorkshire and Bassetlaw.
Okay, thank you everybody for coming, and for the members of the public, those are the people who are taking part today. At the end of this meeting, there's the opportunity for the general public to ask questions related to this agenda. And to that extent, I would ask Richard Walker to come in. Richard, as you've already heard, is Head of Governance and Assurance, and he will guide us through that, assuming we've had any questions from the public. I will, wherever possible, try and address any jargon words as they crop up, because they do crop up from time to time. So, with your permission, I'd like to start the meeting with agenda item 1, which is Leanne, apologies, please.
Yes, we've got them from Dr. Nick Balash, Ruth Sims, Sue Womack, Chris Edwards and Roxanna Naylor.
Okay, thank you. We did talk earlier, Leanne, about quorum. Are we quorum?
You are.
Thank you. Item agenda 3 then, any declarations of interest, please, in relation to this agenda? No, all comfortable about that? Okay,
Chris,
let's move.
Sorry, Chris, just for the minutes, you'll have seen in the covering paper that Madwy's declarations of interest were not included in the covering paper because we were still sort of waiting for the form. We've now had the form from Madwy, so thank you for that, Madwy. And I just wondered if we could minute what those interests are for Madwy. So
Okay.
So Dr. Gunn-Muckler obviously is a senior GP at the Apollo Court practice. That practice is a member of Barnsley Healthcare Federation, which provides services for Barnsley CCG, and Dr. Gunn-Muckler's spouse, Dr. Vermeulen, is also a partner at Apollo Court and the Grove practices. Is that accurate, Madwy?
Yeah, and just one more I forgot to add is he's also a member for Barnsley Health Federation. He's one of the exec members, so if you can take that, yeah. Okay,
thank you. So we've got those in the minutes, and they will now be reflected in the CCG's register going forward. Okay,
some of you have noticed that Madwy had a little hand up, little hand there. So there is a facility within this. Whatever we're doing, to actually put your hand up. If you look at the three little dots, or it should be on top of the screen. So if you want to stick your hand up, you either wave at me if I haven't seen you, or do what Madwy did there and put a little hand up there. So thank you for that. Thank you, Richard, for addressing that. Right, on to item 4 then, minutes of the meeting which we held on the 30th of July. What I'm looking for is accuracy. Is this a true record of what happened on the day? I'm more than happy to accept any minor amendments, and then I will ask that we adopt these minutes, please. So first and foremost, is this an accurate and true record of that meeting? All happy? Okay. Anyone want any minor amendments to these minutes? No? Okay. So can we stick our hands up or whatever? Can we adopt these minutes? Thank you.
Yeah.
Thank you much indeed. Thank you. So on to matters arising. I think most of the people who know me reasonably well now in relation to committees, matters arising are important, but I love to actually get the complete. So again, thank you. 200707, we talked about the GP patient survey, and Julie was going to talk to Victoria Linden, which I think has happened, hasn't it? Yeah. So
yes,
I think,
Chris.
I think we can mark those as complete. Yes.
Yes, thank you.
At the bottom of these matters arising, the information that Victoria very kindly let us have sight of shows what's happening across Barnsley, Bassetlaw, Doncaster, Rotherham and Sheffield, and also on a national basis. So I found that quite interesting, and obviously there is still some work to be done on there. Julie and I have had half an hour on it this week, in fact. Nigel.
Sorry, Chris, just on the first item of the action, that hasn't been done, it is ongoing. It isn't complete until somebody brings me a report.
Yes, Nigel, that's correct. We are working through the whole of the GP survey and looking at all of the specific questions relating to all of the practices feedback within the GP survey. It does take a bit of time to work through all of that. We will be bringing a report back that looks at what that has shown us and what we plan to do with that, as well as looking at some of the wider sort of quality indicators that we have through either the dashboard or through other sort of softer routes, so that we can actually look and support those practices that might just need a little bit of help, or just work with them to understand how they could do things slightly different, and maybe take some sort of best practice from other surgeries that are doing very well.
No, that's fine, Julie. I didn't expect it at this meeting, but that action can't be completed until it arrives.
Okay. No. Thank you for the correction there. You know me, I'm always wanting clears, and probably I did jump the gun there, so I apologise for that. Nigel, have you had the benefit of seeing this survey, the full survey yet?
We've had it, haven't we?
Yeah, no, have you seen it? That's what I'm saying.
I have seen it, yeah.
Yeah.
I still like the action plan that we improved.
Yeah. So yeah. I'm taking it that all of you have actually seen the full printed survey. Is that right, or am I again assuming? And if you assume things, you get them wrong.
No, we did include the whole of the survey in the last PCC meeting for members to have a look at, and Nigel's quite correct. One of the asks was to make sure that we look at that and analyse it and come back and report on what it sort of tells us or indicates, and what we are going to do to address whatever the analysis tells us. Okay.
Just a quickie tip. I don't know whether it works with all of you, but if you're working off a laptop and you are muted, if you press the space button, it will unmute you for a while. Just a little tip that I've discovered. So on to item 6, which is the presentation which James Barker has very kindly agreed to come along and take us through. So, James, over to you.
Well, first of all, thanks for inviting me, and I will try to share my screen so that it's the right presentation. So, can everyone see that all right?
We can. Is there any way you can just pump that up a bit? Is that possible? I mean, don't get complicated, but
I'm not sure. I'm lucky I've managed to get the screen sharing working.
Okay. Get going, James.
So I could circulate it around afterwards.
Okay.
Okay. So it's been quite a few months for everyone, and particularly at the Federation. And we have worked extremely closely with Barnsley CCG, Julie's team, and other people in the CCG and practice to make sure that we've been able to respond to COVID in the most positive way possible. And I suppose the high level result of that is that all practices across Barnsley have remained open during the main sort of height of COVID. BHF, myself and our chair, Dr. Garney, were invited to join the CCG Silver command calls so that we could feed into how practice were doing and how the work that we were undertaking was going to make sure everything was linked together. Throughout the main height of COVID, I worked closely with the CCG's business delivery managers who contacted practices on a day-to-day, every sort of day basis to make sure that they were still functioning, that there were any issues, that we could raise those up to the CCG and we could tackle those head on as quickly as possible. Most of those pressures resolved around staff shortages and the provision of PPE. So again, through those calls, the structure we put together, we managed to keep all practices open. One of the big things that the Federation did during the height of COVID was setting up the COVID clinic, which we dubbed the Blue Clinic. This meant that all practices in Barnsley were operating therefore as cold sites, so preventing the mixing of COVID patients with those that were without symptoms. We got that set up literally in a couple of days, which was impressive. We managed to do some work on the flooring, managed to get all the rooms sort of cleaned and tidied and everything in place very, very quickly. And that was just before we went into to lockdown. And that facility is based at Oaks Park and is provided by Swift for us to use. Over the past sort of few months, the GP streaming service, so that's where we provide GPs to work alongside consultants in A&E, has been suspended to allow the hospital to have both hot and cold sites. And so we were able to use staff from that service to move into the Blue Clinic to keep it going. So in addition to our staff, Dr. Hackner and Dr. Malik, we had Dr. Mills and Dr. Batley, who are two local GPs that volunteered to work with us and do sessions there. So the Blue Clinic was sort of run as part of our iHeart suite of services, and that's managed by a colleague of mine called Thomas, and I'm really not sure whether he's managed to get any sleep between March and present, because we have been working sort of flat out to keep everything going. So the Blue Clinic was running initially for 12 hours a day, 7 days a week. As cases started to drop off, as demand started to drop off, we reduced that down. And between April and the end of August, we've supported over 1,000 patients through that service. What we have noticed, though, as schools and businesses started to get back and up and running over September, we have seen more and more people coming through the Blue Clinic. In fact, the Blue Clinic has been busier in September than it was during the height of lockdown. Blue Clinic was supported by the home visiting service, which was previously commissioned by the CCG. We're able to split that into sort of two parts. So we got visits for COVID patients and visits for non-COVID patients, and so those people that weren't able to physically attend the Blue Clinic were still supported in their own homes. And in addition to all of that, we still kept going with our extended hours and out of hours service without interruption throughout from March onwards. So moving into winter, we think it's going to continue to get busier. And that's been, say, proven through September, getting a lot busier than we'd potentially anticipated. We expect iHeart out of hours appointments to get busier, particularly in weekends, and we're working with the CCG to make sure that we've got a robust plan in place to make sure everything is still continuing to work. But there are obviously pressures with staff going off that are symptomatic, or staff that have been contacted through track and trace. But as I say, we've got business continuity in place to make sure that our out of hours staff, etc., are properly sort of separated at work, and make sure that we've got remote staff, so that if the worst did happen, we had to have more staff off than perhaps we'd planned. We've got staff to then fill those gaps in place. So GP practice, how they got on over the last few months, and I think the response that I've had from practices is very positive. We've tried to maintain a consistent approach between practices, so everyone gets a similar level of service. We followed all the guidelines that have come out and offered total triage, video, telephone, and face-to-face appointments where it's been appropriate. The main things of keeping all this open are the provision of PPE, and that's something that the Federation and the CCG have provided as a collective across the last few months. So together we secured bulk orders of PPE to make sure that practice had that in stock, and whenever practices have then sort of said we're running short, we've been able to provide that the same day. Also, opening up more services within GP practice does rely on other parts of the healthcare system in Barnsley, and they are supporting practice to continue to open up. And again, the continuation of the COVID clinic is important to make sure that practices, wherever possible, can have that distinction between hot and cold sites. So importantly, what have we learned? Well, I think the Barnsley healthcare system as a whole works exceptionally well together. Both people and practices were keen to support each other. From a federation point of view, we've worked really well with the CCG, Barnsley Hospital, Swift, and the council to make sure that everything is linked together. People know what's going on, and we can support each other. In terms of things that we've achieved, we've turned on video consultations. That's something that we had planned to do in iHeart for a significant period of time, and literally as soon as COVID sort of came about the way in which it did, we turned that on very, very quickly. We've set up new services within the space of a couple of days, and we've completely transformed the way in which practices operate and open, again in a very short space of time. I think the most important thing to recognise is there are some really amazing people working across the NHS in Barnsley and the council as well, that have really made sure that people in Barnsley are properly supported. So I think that's really important to note. So I'll just pause there for breath and see whether anyone's got any questions before I move on to the progress of the primary care networks.
Okay, James. There was a couple of jargon words in there, triage and Swift. So for the members of the public who will be watching this, would you just like to very, very briefly explain triage and who Swift are?
Yes, of course I can. So triage is the process of when you ring the GP practice, we'll ask you a series of questions to determine the best course of action for you. So that might be an appointment with GP, appointment with a practice nurse, or it might be signposted to another service. And Swift are the community service provider in Barnsley, which stands for South West Yorkshire Partnership Foundation Trust.
Many thanks. Any questions for James before he moves on? Can't see any hands. Adwi.
Yeah, so I just want to pass a little comment rather than a question. I just wanted to say my experience as a GP working during COVID times and sharing the experience with colleagues who work in Wakefield, Rotherham, Doncaster. And I think what BHF has done during COVID time has been phenomenal. I think the streamlining of service was fantastic, and hence I think that was reflective in the outcomes that have been achieved for COVID patients in Barnsley. And I was speaking to colleagues and also who've actually worked in Doncaster. And I think the system, how it has been set up in Barnsley, wherein we were actually triaging ourselves as GPs and sent patients where they need examination to COVID clinics, and only those who needed admission to the hospitals were sent into the hospitals, meant that the outcomes for the patients who were really poorly with COVID was fantastic. So I think how BHF has actually played their part in COVID, I think it would have been impossible to achieve what we've achieved without their help through COVID time.
Thank you very much.
Thank you, Madhuri. That's fantastic. If I do have a hope and a wish, it's that the fact that we are recording this and we're going to put this on our website, that the people of Barnsley take the time and trouble to come in and just see what's been happening behind the scenes. So James, I have to echo what Dr. Gunter Muckler has just said, and if are there any more questions? Nigel.
Well, I don't know if it's necessarily the right question, but can you just, none of this is about testing, is that because testing's separate from the Blue Clinic?
Yes, that's right. So testing's been done separately. This was about providing medical support to patients that were symptomatic.
Okay, thanks for that.
That's right.
Okay, James, you want to move on then?
Yes. So the sort of second part of all the work that's been going on over the last 6 months has been the progress of the primary care network in Barnsley. Now, this is a newish initiative around supporting general practice to increase staff within practices, and also to focus care on certain areas, which I'll come on to in a minute. So for those that aren't aware, we have one primary care network in Barnsley, which is underpinned by six neighbourhoods, and each of those neighbourhoods has a clinical director who is responsible for providing leadership in that neighbourhood and making sure that practices have a voice within the network. So the main sort of cut and thrust of the primary care network is centred around a number of new services, which are structured medication reviews, early cancer diagnosis, and enhanced health in care homes and social prescribing. So as I said, we've been working very closely with clinical directors and practices and the CCG to ensure that the service specifications will be delivered from the time which they're meant to be. And that's been a significant amount of work, considering we've been dealing with our COVID response as well. So to tackle both sides of this is again another really big achievement for practices and the Federation. So the biggest specification is centred around the care homes and how they will be supported, and that comes into place from the 1st of October. And in summary, that's about providing enhanced care through home rounds and providing personalised care planning for residents. And that's been building throughout the COVID period as well. So it's just continuing to enhance that offer. We've also set up a new social prescribing service. So we'll work alongside My Best Life, and this is centred upon children and young people. So particularly sort of 16 to 18-year-olds who might be struggling with pressures of school, physical inactivity, poor mental health and well-being, and that has just started. And we've recruited a team again whilst COVID's being happening to staff that, and that launched a week or so ago. One of the biggest parts of the work involved with the primary care network is recruitment. So as I said, this is about strengthening practices and increasing the number of staff that we've got. So as we've got one network, we're looking at how we do this as a collective. So between now and my hope is by the end of December, we will have in post an additional 24 whole-time equivalent care coordinators, 18 whole-time equivalent health and wellbeing coaches, an additional 7 clinical pharmacists and 2 pharmacy technicians, 19 new physician associates, 2 first contact physiotherapists to go with our existing 7 social prescribers. So just as a quick overview of those roles, care coordinators will help support the care homes work, supporting MDTs, which is multidisciplinary teams, and to help support individual patients that need extra support from their practice. The health and wellbeing coaches is around encouraging people to think about their own lifestyles and how their health and wellbeing affects their long-term conditions. The clinical pharmacists will be working as part of delivering the structured medication reviews. And physician associates are new to sort of primary care in Barnsley. We have had a few in the past, and they are recent graduates who are able to support the nursing and GP teams within practice. The physiotherapists are just that, physiotherapists that will be practice-based and be able to support patients rather than going to see a GP. And the 7 social prescribers work within the social prescribing service. So that is a massive number of people that we're looking to recruit, particularly doing everything via Teams in terms of interviews and inductions and making sure people are safe. And we've got all those interviews booked in. We've already offered to a number of people already, so we are confident that we will get all those people into post to support practice and patients of Barnsley. So all of these roles will be really important going forwards, not just for delivering on the primary care network specification, but enhancing the way in which we deliver care across the patch and making sure that we have a consistent offer for patients across practices. And it's also about bringing staff together to work together as teams across neighbourhoods as well. And I think that's probably enough from me.
Wow. James, a very bullish, ambitious plans there. And my immediate thought was that I think I need this presentation to go forward to Barnsley Patient Council. I really do. That would be fantastic to let the attendees of that important quorum to see what the Federation have been up to.
Yeah, more than happy to do that.
In relation to the care homes situation, I have, thank you for sharing, I've seen a lot of your emails flying backwards and forwards, but are you actually going to be on target for the 1st of October?
Yes, we will. Yes.
In relation to 79 new roles, I'll say you're very bullish there, James, and I wish you well, because if you pull it off, then that will be a great support into primary care. And in situations like this, always in the past, I've always said, yeah, okay, but who, where, what, and how are you going to do it? So I know you've answered part of that in relation to you've interviewed, you're on the ball. You've already got your 7 social prescribers, and I'll reiterate it is for young people, and we'll work alongside our own CCG, My Best Life. So are you confident?
Yes, I mean, so both myself and the rest of the sort of BHF team supporting the PCN have literally got sort of wall-to-wall interviews over the next 2 weeks, in addition to all the interviews that we've done this week. So as long as we're finding the right candidates, which based on the applications that we've received, we certainly should do. We've got more than enough interviews and people to see to fill those vacancies. And if there's any sign that we're not sort of getting the right candidates through, which I'm sure we will do, then we'll put the advert straight back out. We've also got then inductions ready to go for all these people, which has been the trickiest part in terms of how do you induct large groups of people in a sort of social distancing environment, which we were successful in doing with the social prescribers. They had a 2-week induction with us, where we've given them a whole host of different training, showing all the clinical systems, the way in which it will work, and they're at the moment mapping services out, receiving referrals, and making contact with people that we will work with going forwards.
Okay, Victoria.
Thank you, Chris. Yes, James, I mean, it's always good to be optimistic and ambitious, and I think it's really good to see that you've got those plans in place for, as you say, quite a number of additional roles. But I think if you've got those interviews in place, that does give some reassurance. I suppose the other question, which sort of follows on a bit from the induction, is also then about the training and development support for those roles, because I appreciate that there's quite a lot to then do as well, isn't there, on an ongoing basis? And I wondered if you'd been able to sort of firm up your plans for that yet.
Yeah, so all those members of staff, the plan is currently to employ them by the Federation. So we will look after them, but they will then be embedded within practice and working alongside the practice teams. In Barnsley, we're lucky to have the best events. So we plan to use those afternoons in particular to bring those groups of staff together for ongoing training. We're trying to do as much as we can during the induction period, but then recognise we are limited by sort of social distancing and things at the moment. But we will make sure that everyone's got the training that they need. So, for example, the social prescribers, they've had specific young persons training how to interact with young people. They've had motivational interview training, clinical systems training, the referral management training, and they've come together to look at the sort of processing of referrals as well. So we really packed a lot into 2 weeks, and we're looking to do something similar, but not necessarily over the same time period. We want to make sure that we're getting people trained up and out into practice, where the sort of the second part of their induction will come in. But we have got those plans to do ongoing training. So not mental health. The health wellbeing coaches will also get motivational interview training as well, and things like that.
Thanks, James.
That's all right.
Any more questions for James? James, thank you. As always, a very professional presentation. I thank you very much indeed. Thank you.
Thank you.
Wow, that's pretty good. Yeah, I'm a bit wowed by that. That's marvelous, really. So on to item 7, which is the finance update, and Julie Frampton, I think, is going to take this. Didn't you were an accountant, Julie?
It is me. Roxana and Ruth asked me to pick this up because both of them can't be here today. Finance is not my forte, so please bear with me, and I will do my best. So Ruth has very helpfully provided the committee with an update of where we find ourselves in the first 6 months of this year, given that it's been a little bit complicated by COVID, which has already been sort of reflected through other comments through committee today. The indications are that we have an overspend as it stands at the minute. We are still, well, we've actually just received some of the allocations and framework and planning, and Roxana is working her way through that, so we will have a better idea of what the finances and the implications of that will be. At the minute, this is just a very high level view to give committee an idea of where we are with our budgets, and we will update further as the position becomes a bit clearer. But just to note that there is an overspend to month 6.
Okay. Any questions for Julie?
Maybe we could just clarify that there is an overspend, matter of opinion. That will be part of the top-up allocation for month 6, so that is not a deficit in itself. Sorry, Julie, but I think it's important that that's clear. So we're not 583,000 in deficit. That's just money we haven't yet received from NHS England.
I believe that is the case, yes, but not being a finance expert, Nigel, I will seek clarification if that's okay for committee.
I think there is
earlier. I'm sorry.
There is a line in the report, Nigel, that's I think that's what that's trying to say. I'm just looking. Is it on the bottom of the first page, just before that little table? I think that's.
Yes. Sorry. Yes. Yes.
No, it's not, I was just reading it while you were. It just say it will be included as part of the top-up allocation expected up to month 6. So that seems to be the understanding. Yeah.
Okay, thank you.
Sorry, I was asked quite short notice to present this, so apologies if I've caused confusion.
Julie, you've done a fantastic job. Nigel, thank you for coming in to support Julie on that, which I knew you would. Thank you for that. And Victoria, thank you for just clarifying the situation as well. So any further questions for Julie or Nigel? No? Okay. Right, okay, let's move on then to agenda item 8, which is the CQC update. Again, Julie, you'll know all about this.
Yes, so this is just really to say that even though the CQC aren't carrying out sort of on the premise inspections, they are still keeping a sort of a wary eye around some of the quality role that they have, and we do still have regular meetings via Teams with the CQC, so we are aware of any information that's occurring, or anything that the CQC are sort of picking up, and we have those discussions. So this is just really to say that even though there isn't anything formally happening with practices, the quality aspect isn't being forgotten, and that we are still keeping an eye on that. And this was just to reassure the committee that we are taking this seriously still in COVID particularly, and we are in the background still doing quite a bit of work around the quality agenda.
Okay, Julie, this paper was for assurance, so is the committee assured on what you've heard and seen today? Yes? Okay, thank you. Any questions for Julie? Okay, let's move on. We're on to agenda item 9, which is you also, Julie.
Yes. So the paper here is outlining the contract variations that have been requested in year. The first one is around notifying committee that Dr. Krishnasamy has resigned from practice, and that as they are on a GMS contract and there are still members on the contract, that this is just for information only and has been approved. And the other item is rent reimbursement for GP practices. So in line with the premises cost directions, Penistone Group Practice have had their rent reviewed, and there has been an increase in their rent reimbursement, and this is accounted for through the CCG budgets. So this is just to provide information and assurance around contractual issues.
Okay, Victoria, I normally come to you on this to make sure that NHS England know the hell we're doing. So I'm sure you're content on this one, are you? Without putting words into your mouth.
I'm absolutely content, thank you. Yes.
Okay. Any questions from anyone? No. Okay, we're all assured on that. Thank you, Julie. Right, Richard Walker, agenda item 10, risk and governance report, and again this is here for assurance.
It is indeed. So you've got the usual report. As far as the assurance framework is concerned, committee may recall that through the COVID, the phase 1 of the COVID peak, if you like, we kind of paused the assurance framework because for our strategic objective, the almost entire strategic objective became about responding to the COVID pandemic. We're now moving obviously into a different phase, so we are, as we speak, working on reviewing and updating the assurance framework so that we can start to monitor it and report it through our committees for the second half of the year. And so the next time this committee meets, you will get an extract from the assurance framework with the sort of primary care element of that for your consideration. As far as the risk register is concerned, we have continued to populate and update the risk register throughout the COVID period, and you've got the relevant extract in your papers. There's nothing specific to bring to the committee's attention in terms of proposed changes or additions to that, so it's just there for information, but also if anybody thinks there's anything missing or anything that they think isn't sort of appropriately scored, then obviously this is the opportunity to pick that up.
Okay, I know you've all been through it, apart from probably James, who's not seen it, and Carrie. Are you happy that this risk register is up to date and relevant? Yes? Okay, thank you. Richard, thank you for that. You know, it's my... Okay, we're coming slowly to the end of this particular committee meeting. So what I'd like to ask of the committee is in relation to the conduct. Were you happy with the quality of the papers that you've seen?
Yes.
Any other areas for assurance? I mean, a good proportion, if not all, of the papers today have been here for are here for assurance. And thirdly, would you like to identify any further training needs? So can I assume, no, I can't assume, I'm asking, are you happy with the quality of the papers? Nigel?
Thanks, Chris. Slightly going backwards, I guess, but the risk on the risk register, the first one that's read, even that's about staffing and the staffing for the PCNs, etc. It might be useful to have an update from James, if possible, either at the next meeting or the one after, where you get into with your recruitment, if that's possible.
Yeah, I'm happy to come back and keep people up to date with how we're doing.
Well, yeah, I mean, either come back or submit a paper. I don't really mind, but it would be useful for us to keep on top of where we're going with that.
Yeah, not a problem.
Thank you very much.
Thank you, Nigel. Carrie Abbott.
Yes, thank you, Chris. I've just got a couple of questions, but they're not related to the papers. I don't know if this is the right part of the agenda to ask them or if I should wait until later.
Carrie, I love questions. The more involvement, the more. Come on, let's hear what you've got to say.
So just a couple of really quick questions around assurance, and they're both COVID related. And it might be that Julie might be able to answer because she kindly comes to our outbreak management group meeting that we have weekly. So the first one was around our primary care standard operating procedures around COVID, and I know that those are being worked on, and just in the meantime, just to get that assurance that the right guidance is going out in the meantime to our primary care colleagues. And then the second one that Julia asked me to bring, so of course I'm just standing in for Julia today as our Director of Public Health, was around seasonal flu and flu jabs. And at our outbreak control board this week, board member commented on difficulties around accessing flu jabs in primary care, and Julia said that she'll just bring it here to raise at the committee today.
Well, can let Julia.
Sorry.
Carrie, I've been hassling. If that's the right word, it's not the right word really, but I've been asking Julie every single day how we're doing with the flu program, and she got totally fed up of me. But I'm sure she's going to be very, very positive about this, because if ever there was a year when we need to concentrate on our flu program, this is the year for sure. And in terms of assurance, I'd like to assure the committee that I've actually had my flu jab. I've also had a pneumonia jab, which I didn't even know I could have. So yes, my local GP practice handled it beautifully. I was revved up by Dr. Gunter Buckler a few weeks ago when she explained what they were doing up at Apollo Court there. And I'm sure the rest of our GPs are really revved up for it. But the question was directed to Julie, not me. Julie.
Okay, thank you, Chris. So yes, we have got regular flu meetings going on with various different people. The practices are well aware of what the ask is of the practices, and they are really gearing themselves up to do that. I think each practice is in a slightly different state of readiness, and I think that's probably around some of the vaccine availability for various different cohorts. But there are plans in place. There are plans in place to make sure that social distancing is adhered to and things like that. And in terms of trying to sort of manage flu, we are looking to try and sort of stop some of the disinformation that is circulating around, not just Barnsley but through social media routes as well. And I know our comms team and other comms teams are on with that, so we are trying to address that. But I'm quite confident that our practices are on top of things. We have a number of practices that have requested some support from our community nursing teams to help with flu vaccinations into housebound patients. So that there is that route, and I'm assured that there is capacity for that, which is which gives me sort of confidence that we are trying to get to every cohort. In terms of the SOP for primary care, Sarah Pollard from my team has been working quite closely around developing that SOP with others from public health. We do regularly send not only flu information, but all information that comes out from various different bodies, various different agencies out into primary care through our primary care bulletin. If it's something that's particularly urgent, we make sure that goes out ahead of any primary care bulletin to all of our practices. We also include in our bulletin community pharmacists and other groups, so we try and have quite a broad coverage. So I'm quite confident that we are getting the message out. It's just not everyone reads everything, so again we try and prompt, and I think it's just sort of trying to reassure the general public that we are working really hard this year, probably harder than any other year given the circumstances, but all of our practices are working hard to make sure that patients get what they need when they need it.
Okay.
Thank you, Julie. Thank you, Chair.
Are you assured, Carrie, about that?
That's really useful. Thank you ever so much.
Okay. One voice I've not heard today is my dear friend Mike Sims. So Mike and I are really, I know it's difficult times and we are working in all sorts of different ways, but Mike and I are really missing our coffee machine chats, aren't we, Mike? So are you happy with and assured of all the papers we've had today? Because you've been very quiet today.
Yeah, I've had nothing to add. It's all been very good.
Thank you. And I bet you're missing our coffee machine chats, aren't you?
Yeah.
So sooner or later, we will all be back in Hilda House around the coffee machine, sharing whatever we need to do. So thank you for that. Richard, I'm coming to you now for agenda item 12 in relation to questions from the general public.
Yeah, so we do, obviously we can't have members of the public actually, physically in attendance at meetings at the moment, so we give them the opportunity to submit questions by email in advance, just to confirm for the minutes that we have had no questions for this meeting, so there's nothing for us to pick up there.
Okay, thank you, Richard. Now, this is your committee. All I do is chair it. So what items do you feel that we ought to be escalating to our governing body? Nigel, you're pretty good at this. What do you think we should be escalating to our governing body? Put you on the spot.
Yes, well, I don't know. I mean, the finances will go anyway because the governing body will receive the budgets at the next meeting. So I don't think there's anything to add to that. Contractual issues, there weren't really any. CQC, there wasn't anything. I guess the only thing possibly is an outline of some of the work Bradford Federation have done.
Indeed, yeah, that's that really is super news. So thank you. Anybody
share the slides and do a paragraph, or I don't know, however you want to play it. Bearing in mind that governing body will have a long agenda, and if James wasn't attending, I'm not sure that they want to go through all the slides in detail.
Okay, everybody content now. Victoria, are you happy with what you've heard today in relation to NHS England?
I am, thank you very much. Yes, thank you.
Okay. Right. The date of our next meeting, our scheduled meeting, is Thursday, the 26th of November at 2:30. So I now propose that I close this meeting and we reconvene in about 5 minutes' time to look at the private papers. So thank you very much indeed. Thank you, everybody. Thank you.